Okay, you guys can grab your weekly paper real quick, and we are going to go over your new payday terms. I said I wasn't going to call them that, but I don't think I can help it. So I call my medical terminology quizzes every week paydays. It's like you've worked hard all week. Today is your chance to really earn your pay and make your pay because you've been working so hard. So we're going to have payday every Friday, and that payday is basically the terminology quiz. Okay, that's your terminology quiz every week. So every week you're going to get new terms, and you'll get about 10 new terms and 5 abbreviations. And they're all going to be medically related. And they'll kind of change up a little bit as we go over the year, and they usually pertain to whatever we're already studying. So like our first unit that we're going to talk about is like the history of healthcare, talk about insurance and how important it is. Actually, we'll get to history in a couple weeks, but insurance and just kind of some everyday terms that we use in healthcare. So let's go over those real quick and we'll get going. So first one on your list is insurance. Oh, one thing, look at this note. Your payday quiz next week will be on Wednesday. Okay, I know that normally it's on Fridays, and it will most of the time for the rest of the year unless you have a test or something. Normally it's on Fridays, but next week it's going to be on Wednesday. And the reason it's on Wednesday next week is because Friday is we have another quiz next week. It's a vocabulary quiz, but it's strictly related to what we're studying, so it's an insurance quiz. Your payday quizzes are kind of unrelated to everything else that we do during the week. The words are going to pertain to what we're studying, but it's kind of like its own assignment, if you will. So next week will be a little bit different, but beyond that, they'll be on Fridays. So insurance, it says, is financial coverage by contract in which an organization reimburses or pays for something that's stated in that contract. So you guys know, I mean, you've got car insurance, you've got home insurance, you've got health insurance, dental insurance. So it's just a contract between you and a company where you pay a premium every month. You pay a fee for that insurance. And then that way, if you have something come up, they help you cover the cost of it. So let's say I'm paying dental insurance $10 a month. And that's just, I'm just throwing it out there. It's really more than that. But $10 a month, we'll say, in dental insurance. Well, pay $10 a month. Let's say next month my tooth just decides to like fall out of my mouth for whatever reason. Okay, if I go in, pay my $10 a month, well, if my insurance covers an implant or something new that they have to put back in my mouth, a new tooth, okay, then they would pay for that whole cost. Maybe it's $1,000, so they pay that $1,000, even though I'm still only paying the $10 a month. But the next month, I may not need anything, for my dentist. I still have to pay the $10, still have to pay the fee. So that's it. Same thing with car insurance. You pay that fee every month, and then just in case you have a wreck, then they'll help you pay for it. Okay, if you don't, then you don't use it, but you still pay for the insurance. So insurance, that's what it does. Okay, epidemic. This is widespread disease usually is a specific location. Like we might have an epidemic in Texas, or like we had the Ebola epidemic. I don't know if that was actually termed an epidemic, but we had Ebola. It's kind of the same idea. It was definitely an epidemic in the areas of Africa it was in. That was last year, wasn't it? I think it was. Maybe even the year before. So that's epidemic. You guys have heard that word before. Treatment, this is what is done or is given to a person to help a disease or condition. It can mean lots of things. A treatment could be medicine. It could be it could be like radiation could be a treatment. Physical therapy could be a treatment. So anything that's given to hopefully help them to get better. A provider. This is a person that provides some kind of medical assistance. It could even be a business that provides a medical assistance, but usually you think of it as like a physician or a nurse practitioner. Okay, a physician is a doctor. When you hear the word physician, just think doctor. That's kind of the lay term for it. 6, geriatric. Okay, we're going to learn more about this word. Geri actually means elderly, and iatro, I-A-T-R, and that means treatment. So the literal meaning of this term, and that's one of the things that we're going to learn this year, is kind of the medical terminology language, is that this literally means pertaining to elderly treatment. It's a word. But when you hear that geriatric, it just means pertaining to the elderly. Like geriatric chair is for people who may not be able to move around very well anymore. Or You may see like a geriatric drink or something like an Ensure or something along those lines. Hospice, number 7 there. This is a specific type of healthcare that's given at the end of life. So specifically for usually palliative care, which means that, you know, they're not necessarily trying to get better. They're just trying to ease their pain, or usually if somebody goes on hospice, they have a, you know, there's the doctor's only given them X amount of time to live. 8 is ambulate. That's a medical term for walk. So ambulate is just walking. Number 9, resident. This is a patient in a nursing home or an assisted living. They don't like to be called patients. They like to be called residents. And that's because they live there. That's their home. You know, it's not like the hospital where you go in and you're a patient for a little while and then you go home. That is their home. So they like to be called residents. And then 10 is rehabilitation, the process of regaining physical or mental abilities, or maybe teaching someone to live with disability. So examples of that, let's say you had a knee replacement, and then you did rehabilitation to improve the use of that knee that you just had to replace so you can get back to normal. Or the process of teaching someone to live. Let's say maybe my arm got cut off in an accident or something. So I'd go into rehabilitation and they would teach me how to manage that disability. That's another example. Okay, 11, PRN. This is as needed. This is on almost every single payday all year long. So memorize it now. I always have people in the middle of May, I'm giving a payday, and they still miss PRN. I'm just telling you right now, it's on probably 90% of the payday quizzes we do for the year. So just learn it now. You'll find that a lot of these abbreviations don't really seem like they're related to the word that they mean, and the reason is that medical terms a lot of times are in Latin. Sometimes they're kind of in Greek, but Latin, you'll see them. And so sometimes that abbreviation is more of the abbreviation for the Latin term instead of the, you know, the term, like the lay term that we use. Okay, rehab is just kind of a shortened version of rehabilitation. EMS means emergency medical services. You guys are familiar with that. MD means medical doctor. So we see that behind somebody's name. That's what that means. And then the VA, so we're going to talk about that this week, means Veterans Administration. And you guys know veterans are the ones who served in armed forces in some fashion. And they, we're going to talk about the VA hospital and VA care. We're going to talk about all of that a little bit over the next week or 2 weeks. So those are your payday terms for this week. My suggestion, get some index cards, write them down, keep them in your notebook, or maybe punch holes in them and, you know, make a little, I probably have some rings somewhere. I can get some to make yourself a little thing, because payday quizzes every week are going to be comprehensive. So every week you'll see old terms on here. Be ready for that. Remember that the quiz is next Wednesday. That's why I went ahead and give them to you early. Wednesday. I know that'll be more different than what we'll start doing after that. That's it. I want you guys to discuss in class today, if you haven't already done that, what careers interest you, what interests you about this class, why are you excited about being in this class, what do you want to learn in here. I just want you guys to talk to each other, talk to Miss Trapp about that. Let Miss Trapp tell you guys a little bit about her job. And for those of you guys that are here in Cooper, for those of you guys that are in my online class, I want you guys to just discuss amongst yourselves with your teacher, you know, what interests you, what do you want to learn, why do you think you might want to be in healthcare, why do you think you might not want to be in healthcare, you know, what experiences have you had. Why you guys talk about that? The more we talk about healthcare, the more we talk about our jobs, the more questions come up, and the more we can learn. So we're going to do lots of talking in this class. Excited. I will see you guys soon.